Just got some dental industry labor statistics that I wanted to pass along because I think this is one of the primary driving forces behind this DSO movement that we're seeing. So going off the blogs that we got from Group Dentistry Now and Dentistry IQ, which are both great channels, check those out for sure. But as of right now, it had said since 2020, the average office is down 3% in terms of overall production based on the labor market issues. You know, having job postings open, having staff members call off, so not being able to keep up with the production. So overall, since 2020, general offices are down 3% in terms of production. I thought you guys would find that interesting. Also, on average here in the States, your average cost per hire is $4,500. So just to go through the hiring process, the time it takes HR to get them into your system, get them into the payroll processing, get them trained, get them hooked up with insurance, all of that stuff takes $4,500 per employee just to get them signed on. Also on average here in the States, it takes up to 12 weeks to get a job vacancy filled. That's 3 months. I mean, again, that's 25% of your year just trying to get somebody hired. And on average, again, this isn't dental specific, but on average, every vacant job that you have, you're missing out on $100 of profit per day. So that number scales quite quickly. And again, that's not talking in terms of us. The number one job that has been most disrupted is dental hygienists. Unequivocally, talk to any dentist in your area, and they're all going through the same thing. There is a shortage of dental hygienists that happened at the start of the pandemic that just haven't come back. So that is wreaking havoc on the industry. And again, it's driving dentists to look out for additional help. There's just not enough time and bandwidth in the day to go to hygiene schools to put out feelers all the time to stay in those networks. It's very, very hard to have the bandwidth to recruit these high level positions when 4 to 5 days a week you're seeing patients at a high level, and then you have families and lives at home that time needs to be had, otherwise burnout will be felt. So again, I thought you guys would like all these analytics. The one other thing that I found really interesting is from February to March this year, we lost 1,500 dental assistants and just in front office members. So we continue to be actually losing employment instead of gaining employment in this kind of quote unquote post-pandemic era. So you would really be thinking employment would be massively accelerating back up. But again, in February to March of this year, 2022, we lost an additional 1,500 people, didn't add any. So stay tuned. Hopefully some of these industry trends start to change, but I do think the labor market in particular is one of the driving factors behind the DSO movement.